Thank you, Your Excellency, the President of this country, the CS for Health and the PSCs, Chair of Council of Governors and my colleague governors, ladies and gentlemen. Your Excellency, it's okay, Your Excellency, I was addressing, that's why I had to wait for you to at least be able to finish the consultation. We are here at a time when we are coming from a background of a very controversial scheme for medical equipment, which all of us are aware of, which still has not left completely. We still have remnants with us, and that is the famous MES, also dubbed as MES by the senators. Your Excellency, as we start this model, we want to acknowledge as the Council of Governors what has made this process seamless is a consultation that was very involving in terms of leaving no one behind, because at every stage the county governments were involved, the governors were involved. We have signed the IPAs, and I would like to report to you that almost 90% of governors have signed the IPAs. Almost 80% have given their needs, and those needs, as much as we are meeting them now, they are still far from being met. That means the demand is more than the supply, which is a good sign. Why are we excited about this model? Because it's a hassle-free model that does not give us the headache of having to worry about the reagents, the consumables, the service, and even the quality of the equipment, because we ask for 95% uptime, and it should be at the best in terms of the technology. Very happy to learn that now we have 120 or 124 slices of CT scan coming. What we had in the market with the previous MES was 64 slices, and therefore it means we have very advanced technology. Allow me, even as I make my remarks very brief, Your Excellency, to bring to your attention. I mentioned that we have remnants of MES, which could be hindering the implementation of this project. When you have leased a piece of land to someone, Your Excellency, and the period of lease is expired, if they do not want to take away the house, Your Excellency, sometimes we tell them they can leave the house so they can use the rest of the piece of land the way you want. I'm saying this because most of the governors seated here have no space to place the new equipment, because the old ones are still in place. We've had conversation with the CS, and there are tussles between the MES vendors, and I'm happy to see that some of them transition to NESP. Let's have kindness and compassion, so that you don't keep a county that is in need by holding them at lump sum, because you don't want to take away your old machine because you haven't finished the ministry, and they can't put in their new machine. We have plenty of stores in the Ministry of MOH. We also have space in our counties. If they have lack of space, we can give them spaces or warehouse to keep their old equipment and give us room to put new ones, Your Excellency. That is the fate of most of the governors here, because we cannot place the new equipment because the old ones have not been commissioned. Sometimes they make it sound as if it's rocket science or it's a nuclear plant being decommissioned. It's just plucking out, disposing, and putting the new ones. Lastly, Your Excellency, the equipment you're giving us will find their way to level 4, level 5. Very few will get to level 3. We have our own solution to level 2s and 3s. However, Your Excellency, we are appealing. One of the catastrophic circumstances in health in Kenya, which most Kenyans are dealing with, is cancer. Most of the time, this cancer is normally detected when our patients visit level 4 and level 5. And by that time, they have visited the dispensary, nobody could detect cancer. They have visited the health center, no one could detect. And by the time they get to level 4 and level 5, it's already too late. So we are asking the same way, Your Excellency, your team and the ministry thought of a solution to the timely diagnosis at all levels. Think of a solution in cancer diagnosis that can start at level 2, so that our people get detected early enough so that we can save lives, as it were.